Dr. Cagle, Dr. Cagle, call the operator.
Hello, I'm Jean West, and this is Get Healthy with Norton Healthcare. As we enter the prime of our lives, we have different health and medical concerns and needs. With so many of us living longer, so many years of being weekend athletes, joint replacement is a real possibility. Fasten your seatbelts. We take you inside the operating room to show you a hip replacement procedure that gets you back on your feet quicker with less pain.
Dr. Jonathan Yerasimides is an orthopedic surgeon specializing in hip and pelvis reconstruction.
This lady that we're operating on today has osteoarthritis of her hip, and she has pain that limits her daily activities and limits her range of motion of her hip. And so today we're going to take out her bad diseased joint and we're going to put in an artificial joint made up of a composite of titanium and polyethylene.
The team in protective surgical scrubs goes to work. The joint itself is a standard artificial replacement, but the procedure, anterior hip replacement, is not.
The implants aren't any different, but the approach to the hip is different. I use what's called a direct anterior approach to the hip joint, meaning that I get to the hip from the front rather than approaching the joint from the back. The hip is an anterior structure, meaning it's closer to the front of the body than it is the back of the body. So approaching it from the front, it's a little shorter distance, and we're allowed to replace the joint without releasing important muscle groups off the femur and without releasing the back capsule of the hip, which is very important for stability.
Within minutes, the diseased natural hip is removed.
The top is shiny, there's no cartilage left, it's just bone. This person doesn't have any padding left at all on their hip.
And the work begins to set in place the artificial joint.
Image. 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 We're able to use X-ray in the operating room so that we can more accurately control leg lengths as well. So it reduces the chance of making a mistake in leg length one side to the other. It reduces your chance of dislocation, and it helps your patient to recover much faster. So these patients tend to recover a little faster because they don't have muscles released off the femur. They also have very stable hips, so they don't have to worry about bending over or crossing their legs, whereas with the traditional hip replacement, they would have to worry about dislocating the artificial joint, whether the ball pops out of the socket. But with these patients, since we leave the muscle attachments alone, we leave the posterior hip capsule alone, they're allowed to bend over, cross their legs, perform any activity they want with the joint without a fear of dislocation.
For many patients, getting back to that normal activity begins here at the Joint Care Center at Norton Audubon Hospital.
Our joint care program starts with getting people going right away. That night, hopefully after surgery, we can start getting them to do some isometric exercises, working their ankle and their thigh, working off the block that is administered during surgery.
Recovery from various types of joint surgery.
Knee surgeries, hip surgery, the anterior approach hip surgery, the posterior approach hip surgery.
The Joint Care Center at Audubon Hospital is something we initiated, I guess, about 6 months ago. We started, and the idea of it was to improve our outcomes with patients, to allow them to do their rehab at a quicker pace and to be able to go home quicker from the hospital. Instead of having to leave the hospital and go to a nursing home or to a rehab center, to allow them to go home and do their therapy at home with their family and in a familiar surrounding.
Rehab includes strong motivation, Kentucky style.
They actually get assigned a horse. This was designed and painted by one of the nurses here, and every patient is represented by a horse. So if they're in room 2, they're the second horse, and for each goal that they achieve during the course of the stay, they get to move their horse one little post along the way, and hopefully they all reach all 10 goals and graduate or finish the race, achieving all 10 goals that we set for them. And just sneak in right They here. Race and they challenge one another, and no matter if it's a hip or a knee, or we have it all designed where everybody kind of finishes at a good pace, and they all get to finish and feel positive about their experience. Good job, all right. Make a turn to the left.
Then, when the hard work is done, There is music therapy to
Very
soothe
good.
the pain and the soul.